I've got Sister Najeeha here, Najeeha Khan. I'm going to read a little bit of a bio and then we'll get into it. Najeeha Khan's an MS LPC-Associate. She received a master's in counseling psychology from the University of Wisconsin-Madison and has moved to Austin in summer of 2020. She has experience working with survivors of trauma, racial ethnic identity development, anxiety, depression, life transitions, college students, career exploration, and more. Currently, Najeeha is working with Austin Counseling and Nutrition, where she provides psychotherapy to the diverse range of folks. Najeeha specializes in disordered eating, body image concerns, self-esteem, ethnic minorities, mood disorders, and general life stressors. She also integrates Islamic ideologies of healing into sessions with Muslim clients and aims to focus on clients' relationship with themselves, with others, and with their environment. There's a website link, we'll put it out, but thank you, Sister Najeeha, for offering your time, being generous. It's a really very important topic that kind of gets pushed under the carpet a lot, eating disorders, and teenagers specifically are struggling a lot with this, especially in this environment of wanting to watch about their body image and things. And Ramadan is even more harder for them. So I really appreciate you kind of talking about this. I'm going to let you share the screen and start your presentation. I'm going to go mute. I'm on my text room and I'm listening. So let me know if you need anything.
Sounds good. Thank you so much. Okay, Assalamualaikum, everyone. Happy Ramadan. So as Dr. Afshan said, I primarily work a lot with people who have eating disorders and body image concerns. I do see people with a general range of concerns, but that's just the majority of the services that I provide. And I'm going to try to share my screen. It wasn't working earlier, so let's see if it works this time. Bismillah. Okay. Okay, I think that's working.
Yes, it is.
Okay, good. Okay, yeah, so I totally agree. I think that eating disorders in general is something that we don't talk about in the Muslim community. I think there's a lot of misconceptions that it's just something that either we don't experience at all for whatever reason, or if we do, then it's a very small minority. And although we don't have exact research on eating disorders in Muslim communities, we do have a lot of research that suggests that it's actually a higher number of people who are minorities experience eating disorders than people from the majority culture. So just from that, a lot of people do infer that then, you know, racial ethnic minorities, religious minorities tend to have higher rates of eating disorders. And it is something that is a unique struggle during Ramadan, just because like for people who might, their eating disorder might involve starving or restricting, this can really trigger them. And I will talk a little bit more about that. So basically, I don't know how familiar everybody is going to be with eating disorders. So I'll just kind of go into what the common known eating disorders are, what potential causes can be, how we treat people with eating disorders, how to know if somebody has one, and how it can affect somebody during Ramadan, and then sort of what to do if you or someone you know has an eating disorder. So you all can feel free to type questions into the chat. I'm not sure that I'll be able to see it during the presentation, but I'll definitely try to answer after the presentation is done, inshallah. Okay, so what are eating disorders? So eating disorders are any cluster of disturbed eating patterns. They can or cannot be impacted by body image concerns, so wanting to shape your body to look a certain way, and so controlling your eating / exercise in order to do that. Usually it involves changing your exercise as well, but not always. There are a variety of different kinds of eating disorders, and again, I'll go into the known ones in a little bit. And they can present differently in people. Eating disorders, so the estimates in the general US population, it can be anywhere from 1 to 10% of people, and that depends on the specific type of eating disorder. So as you can see, it is very, very common, much more common than you think, and it is certainly not something that only affects teenage white women. I think that's what the stereotype tends to be. It can affect all racial and ethnic groups. It affects men, it affects all age groups. Some people have a lifetime of eating disorders. Some people will kind of start with one eating disorder and then it'll kind of transform into other eating disorders as they grow older. And some people are able to kind of heal from it and move on after they grow older and they get treatment. So I'll start with anorexia nervosa just because I think that tends to be the most well-known one. So this is extreme food restriction. It usually involves an intense, very intense fear of gaining weight. There can sometimes accompany with it a distorted body image. So a lot of times folks with anorexia, they'll have this experience where they might look in the mirror and they'll just see a very large body. They'll see a lot of fat. They'll see something that other people aren't seeing. So other people might look at them and be like, oh, I don't think you're actually pretty small. I don't see all this fat that you keep pointing out. But to them, they really do see that in the mirror, and it's something that's very frightening for them. So it can present in two different ways. It could just mean that they're just restricting their food intake. They may not be eating at all or just very, very small amounts throughout the day. Or it could be cycles of binge eating and purging. So that might mean that they restrict, and then, what naturally happens, as we are all experiencing in Ramadan, we can relate to this. What naturally happens when you haven't eaten in a while is then you will feel the need to eat a lot when you are given access to food. So what might end up happening in the binge eating and purging group is that they might end up eating a lot more than they intended, and then there can be a lot of guilt and shame associated with that and fear of gaining weight from that. So then they might engage in purging or more restricting after that. So they might induce vomiting, they might over-exercise, they might fast the next day, and they kind of just get stuck in a cycle of binging, purging. People with anorexia nervosa tend to be underweight for their age and their height as well. I also wanted to include the consequences associated with these eating disorders. And I want to just say that I did not put these consequences up here to scare anyone, even though I can recognize that they do sound pretty scary. That's not the purpose. I really just wanted to put this up here to help people have empathy for those who are going through an eating disorder. It can be a really, really awful experience. As you can see, it's not something that just impacts, it's not just a mental illness. It can impact your whole body, your emotions, your mind. It can impact your health in the short term and the long term. And so it's important to have empathy for people who are going through it because they really are being impacted very pervasively. So with anorexia, we oftentimes see that people, because they're not having proper nutrition, they might feel cold all the time. Women and girls might experience a disrupted menstrual cycle, dizziness, they might have anemia, they might notice their hair thinning, dry skin, constipation, constantly feeling exhausted. Some of the long-term effects, so like that means that if they've had this eating disorder for years and years and years and never ever got treatment for it, in the future you might even notice some bone thinning, so even some brain damage and organ failure and infertility issues as well. So it can be pretty serious. Something that I've also noticed in my clients as well, this doesn't always have to happen, but it can definitely happen. The age, especially with teenagers, the age that they stop getting proper nutrition, the age that they kind of start to restrict, tends to be it can be the age that their brain stops developing. So there might just be a little bit of a pause on their brain development. So if they were 15 when they started restricting their food intake and it got pretty severe, then, even when they turn 16, 17, if they're still restricting, it might be like their brain is still kind of at the maturity level of a 15-year-old. And that's just because it didn't, get the proper nutrients to grow and mature and develop. I've seen that oftentimes in my clients. It doesn't always happen. It really depends on the severity of the eating disorder and other factors as well, but it's something to look out for. Okay, another common known one is bulimia nervosa. So bulimia is somewhat similar to anorexia, with the episodes, the cycles of eating large amounts followed by purging or compensating. And so that the large amounts, that could mean that they're eating to the point of extreme discomfort, or they are in pain. Sometimes it could mean that. And then it's compensated by either vomiting, using laxatives, fasting. It could be excessive exercise, just things that they might be doing to try to lose the weight that they perceived putting on during that episode of eating a large amount. The difference between bulimia and anorexia is that people with bulimia can be of any weight. They usually fluctuate just above or below their regular weight. So this one is a bit more, it can be more dangerous because it's much harder to notice in somebody because they won't really look any different to you. Consequences of bulimia nervosa, if they've been engaging in a lot of induced vomiting, there could be tooth decay, acid reflux disorder, gastrointestinal issues, dehydration, general intestinal distress. There can also be some cardiac issues and electrolyte imbalance. So again, it can be very serious if it goes untreated. All right, I think the third most common one is binge eating disorder. So folks might have heard of this one. This is episodes of eating large amounts, again, to the point of pain or discomfort, but it's not followed by that purging or that compensation. So this could look like eating too much too quickly or just too quickly. It could look like eating a lot when you're not even hungry. And a lot of times people with binge eating disorder, they describe this feeling of just being completely out of control. Like they don't even know what's going on. It just feels like they're going 0 to 100. There's food in front of them and all of a sudden they're eating, and they cannot stop. So it can be a really distressing, really, it can lead in a lot of shame and guilt for people who are experiencing this. The consequences of binge eating, again, GI distress, heart complications. There is a correlation with adult onset diabetes and sleep disturbance, specifically sleep apnea. There can be, again, fertility issues and gallstones as well. So it can also be a serious disorder if not treated early. So all the consequences I listed, again, it was not to scare you. All of these are reversible if it can be treated early and if it can be given the proper treatment. And then I also wanted to just make a quick explanation on some of the lesser known eating disorders. Orthorexia is not formally recognized as an eating disorder, but it is there. And it looks a bit different, and it can really go unnoticed because it's a lot of people will go through the symptoms that I'm going to describe here, and it won't always be seen as a negative thing. So people with orthorexia will have an obsession with healthy eating. They might even cut out entirely certain food groups, like they'll just not even go near any sugar or carbs. They might engage in a lot of calorie counting and checking ingredients. So like before they go to restaurants, before they go to an event where there will be food, they might ask ahead of time what the nutritional facts are. They might even be interested in other people's eating habits and wanting to make sure that everybody else is eating healthy. And they might experience a lot of distress when they don't have access to their healthy foods. And I put healthy in quotes just because, there's a lot of debate on what healthy even means, especially for somebody going through an eating disorder. Eating healthy may not always be good for their body. For example, I've had clients who have tried to only eat veggies or something like that. And then obviously that's not good for your body if you're not getting protein, if you're not getting carbs or other things. And so sometimes eating only healthy foods can actually be very unhealthy. And this usually is also associated with body image concerns and wanting to be thin or muscular or whatever they want to achieve. And then there is avoidant restrictive food intake disorder. This is ARFID. And so it can be a significant weight loss due to not getting an appropriate amount of nutrition. There can be nutritional deficiencies. There usually is not any fear of weight gain or body image concerns with this. People who have ARFID, They're not eating, not because they want to lose weight, but usually because they may have sensory sensitivities. So like they don't like the texture of certain foods, or the smell or the sight. They could be afraid of the consequences of eating certain foods. Like if, for example, if I eat this, then somebody in my family there might be something bad that might happen. Or they may just not have an appetite at all. And so this one, it can be a bit trickier because it can start in childhood usually, and usually it's the result of trauma or some kind of stressor. And so again, with causes, trauma, with all eating disorders, not just ARFID, trauma is a huge predictor. When people have eating disorders, we always screen for trauma because that is just so common in this population. So by trauma, I mean any sort of really distressing event that might have threatened that person's sense of stability or safety, either mental, emotional, or physical safety. And it really impacts somebody's worldview. It shatters it, actually. And so that is a trauma. That can be like a physical assault. It can be food insecurity. It can be abuse. It can be bullying, really anything. Another huge cause of eating disorder is either a family history of eating disorder or parents, caregivers who talk about dieting a lot or who talk about their own bodies negatively a lot. So I think this is something that people kind of overlook and don't realize. But yes, when parents and family members are talking about their own bodies negatively, so it could even be seemingly harmless comments like, oh, like I need to get back in shape, or my legs are so fat, or something like that. We're just constantly talking about, okay, like we're not going to buy sweets anymore. We're only going to cook healthy from now on. Constantly making comments like that, it does affect children, especially children who have had that trauma or who are susceptible to an eating disorder. So, we always, when we work with teenagers and young kids, we always tell parents to really avoid diet talk and avoid talking about their own bodies negatively, because your kids are absorbing that in a way that a lot of us don't realize, I think. Involvement in sports. So eating disorders are actually huge in people who are athletes. And exposure to diet culture. And I will explain what diet culture means soon, as well as exposure to social media. Everywhere you look, there's unrealistic body types. There's constant talk about dieting, how to lose weight, all those weight loss programs. There's ads everywhere. So it's kind of impossible to not be attuned to that. And so I think that also can really affect, especially a young child who does not yet realize that there might be something wrong with their body. And all of a sudden they go online and they're just seeing all this hate towards people with large bodies, and it can really affect somebody. So really quick, the relationship with mental health and eating disorders. I just thought I'd add this because yes, it is such a physical experience, but usually with eating disorders, there is an underlying anxiety, depression, or trauma response going on that can sometimes cause the eating disorder. With eating disorders, I mean, as you can probably assume, they're really distressing to live with. It's just distressing to have an eating disorder. It's distressing to try to maintain an eating disorder. It's distressing to sometimes not see results. So by that, I mean, a lot of times people are wanting to lose weight and their eating disorder may not give that to them, and that can be distressing to them. So that can feed back into the anxiety and the depression. And there's also another piece to it as well with eating disorders, which is that when your brain is not properly nutritioned, it's not being fed well, that can really negatively impact your mood. That will spike your anxiety, that will spike your depression, that will spike your stress response. And so that also then really intensely feeds back into the anxiety and depression. Okay, so now I want to explain what I mean by diet culture for those of you who may not be familiar with the term. So diet culture, it's really what we live in right now. These are cultural norms, values centered heavily around dieting and exercise. And it's the idea that being thin equals being healthy, and it can get you moral status. And so then weight loss, therefore, is a way to achieve that status in society. It sells the idea that if you are able to be thin, then you can have it all, basically. And that's why in ads, on TV, on social media, you'll only really see thin bodies with really unachievable proportions. So people are basically celebrated for counting their calories, for restricting their food intake, for cutting out certain food groups, for over exercising, right? So if somebody says, yeah, I spend 2 hours at the gym every single day, that is seen as a good thing in society, and we celebrate it, and we don't stop and ask questions on, okay, what is that really doing to your body? How is that really affecting you? So diet culture glorifies losing weight at all costs. Diet culture usually doesn't care how you're getting there, it just wants you to get there. It doesn't care if you're starving in order to get there, it just wants you to be skinny. It's a business that ultimately results in a lot of discrimination, a lot of trauma for people. So what I mean by that is people who are in larger bodies, they will not be treated the same as somebody in a smaller body. They won't have nearly as much privilege when they're going to apply for jobs. They may not even have an easy time finding a job because of their body type. I have a lot of clients in large bodies who unfortunately have gone to doctors, and they could have gone to the doctor for like the flu, and all they needed was medication for their flu, and they'll be told, well, you need to lose weight. And it could have nothing to do with their weight, but they'll always be told you need to lose weight. And obviously not all doctors are like this, but for clients who have had that experience, it's actually really traumatic, and you can see that it would make somebody not want to ever go to the doctor again and just sort of avoid that situation entirely. On this page, I included common images, messages that we hear that are related to diet culture. So we always see jokes about people in larger bodies, right? All those fat jokes, weight jokes. We constantly see those like getting the body you want, tiny waist workout challenge, or skinny legs, thigh gap workout challenge. We see that everywhere we go. The concept of a cheat day, I think, can be problematic, especially for somebody with an eating disorder who we're trying to help them get permission to eat all kinds of foods. All those boot camps to change your body. Even I included this image of a Barbie doll because it starts young, right? Like children get exposed to toys that look very unrealistic at a very young age. Weight Watchers has a whole aisle devoted to it sometimes in a lot of grocery stores. And just saying things like, oh, you look good. Have you lost weight? Telling people, oh, wearing black makes you look skinnier, or just messages like that. It can be very harmful. Sometimes when we make these comments, we're not trying to harm somebody, we might be trying to compliment them. But what it can tell somebody, especially someone who is having disordered eating and body image concerns, what it can tell them is you're only worth something if you're losing weight and if you're looking skinny. And as you can see, that is a very harmful thing. All right, so here are some more things that are encouraged in our society or seen as acceptable, but could actually be really, really dangerous. So female athletes having an irregular menstrual cycle, always commenting on people gaining or losing weight. School cafeterias limiting how much kids eat and encouraging healthy eating. Again, what does that even mean? And the media only showing images of perfect bodies and those unachievable proportions. So how would you know if somebody has an eating disorder? You probably won't. It can fly under the radar very easily. Gender differences also make it super difficult to spot in men. So for women, a lot of times what we see is wanting to lose weight and achieve thinness. For men, it doesn't usually look like that. It can, but it's more likely that men will want to change their dieting and their exercise in order to look muscular. So that might mean actually eating a lot to bulk up and cutting out certain food groups or something like that. And so it can be difficult to spot in men because, again, we celebrate that. We celebrate somebody wanting to get muscle on their body. And that's not necessarily a bad thing. I think where we get concerned about somebody's mental health is when it does cause them distress and it impacts their relationships drastically. Okay, and again, it can be hard to identify because a lot of people, their weight does not fluctuate that much. So you wouldn't be able to see it on someone. People are also very, very protective of their eating disorder. And so they might, they might not be showing signs or symptoms. They might be hiding those things so that people don't find out. But I did want to include some ways that you might be able to get clues about an eating disorder, just in case, if you're living with somebody or if you have a loved one that you're feeling concerned about. So if you've noticed a change in their diet and they also have health complications that come out of seemingly nowhere, that can be a clue to an eating disorder. So for example, if randomly they're like, I don't know why, but I've just been getting so dizzy lately, or I've, that's a huge red flag if they're getting dizzy when they stand up, or my skin has just been feeling really weird lately. And on top of that, they haven't had any other changes, but that their dieting and exercise has changed. So those can be clues. So you could look for an immense amount of weight loss in a relatively short time frame, but that can be a little bit tricky because you might not always see that. And it could be because of other health conditions as well. So you might want to first see if they have other health conditions going on. If not, then that might give you a clue to some disordered eating. If people are having difficulty with eating in front of others, that might also be a clue that they are suffering with some disordered eating. They might also be hoarding food and snacks. So people who experience those cycles that I talked about, the binge eating and purging cycles, there might be a lot of shame around eating. And so they may not really want other people to know about what they're eating and how much they're eating. So they might hide their food. They might also, so there's some interesting research out there that shows that even if people have just been food insecure for like a short amount of time, it can really impact the way they are around food in the long term. So if they experience some starving for a couple days, then they might have some food hoarding behaviors for a long, long time afterwards. So it really impacts your brain. So sometimes people with these disorders also experience some of that trauma on a kind of more physical level, where their brain's like, well, I don't know when's the next time I'm going to get food, so I'm just going to kind of hide it. All right, so treatment. A treatment team is usually needed for people with eating disorders. So by that, I mean therapists, dietitians, doctors, etc. I think at the least, people should at least have a mental health therapist and a dietitian. It's great to also have a doctor if it's kind of on the severe side, just to check out if there's any more serious medical conditions going on as a result of the eating disorder. So what the dietitian will usually do is help people kind of form an eating schedule and get them back on track to proper nutrition. So, what time is a good time to eat for them, how much to eat, how to include proper nutrition into that eating, how to get them to their goal weight if they need to gain weight. And my role as a mental health therapist then is to help them treat some of that underlying depression, anxiety, or trauma, or whatever it is that is causing the eating disorder. So that's kind of my job, and to also just provide mental health support as they're going through this process, because it's not easy to be experiencing an eating disorder, but then to recover from it is also really, really difficult. It's really hard on people's bodies to, it's just a lot of changes that a body can experience, to be starving and then all of a sudden to try to be eating again. It can really throw your body for a loop. So we're really just trying to heal someone's relationship with food and with their body. So that means tuning back into your body's natural hunger and fullness cues. So on this PowerPoint, I included the hunger fullness rating scale that we use with people. So on a scale of 1 to 10, it basically asks, how hungry or full are you? What's interesting is that people with bulimia or anorexia or ARFID or orthorexia, sometimes they will lose their hunger cues because they've been starving for so long and they've had a lot of practice with it. So they could be at a 2, they could be extremely hungry and their stomach might even be growling and they may not even notice it. They may not be able to tell that they're hungry because they've just completely gone numb to it, or they've completely lost touch from their stomach's cues. They will know if they're getting too full. As a matter of fact, they could even only be at a 5, and to them, it might feel like they're at a 9. So our job is to help them get back in touch with those cues and to figure out when they're actually feeling hungry. For somebody with binge eating disorder now, it's going to be a little bit different. For them, they'll know when they're hungry, but they may not know when they're full. So I have some clients who, again, it feels like they're going 0 to 100. They know when they're at like a 4, but they won't know the numbers in between a 4 and a 10. And before they know it, all of a sudden they're at a 9 and they're incredibly uncomfortable and they're having to throw up because their stomach just feeling so much in pain and they're feeling sick. And so for them, it looks like helping them get back in touch with their fullness cues and helping them figure out when they're feeling full and to be able to stop eating when they're feeling full. So it is a completely holistic thing, treating an eating disorder. There's a lot of physical components, there's a lot of mental health components, and it's very draining, it's very exhausting, it's very difficult for people. So now getting into Ramadan. So we must be treating eating disorders as any other illness. People are given an excuse, or I don't like the word excuse, but people are given permission to refrain from fasting when they're going through an illness. It's the same for eating disorders. It is an illness. And as I talked about, I gave a lot of background on how eating disorders can affect bodies, because that really is the main thing here, that if your body is so drastically impacted to the point where it could even be dangerous for you to refrain from eating, then we really don't want you to be fasting. And I think that can be difficult for people. There can be a lot of guilt for not fasting, a lot of shame, and other people might be shaming them too, right? Like there's, a lot of nosy people who might ask questions like, why aren't you fasting today? I've also heard, people say like, if you fast, then, the barakah of fasting will heal your eating disorder. And I mean, I guess that could be true for some people, but for a lot of people that doesn't happen. It could actually just make their eating disorder worse and can really throw off their recovery. It can really, really set them up for a dangerous situation. So how can it do that? I mean, you can imagine in Ramadan, we're expected to kind of ignore our hunger cues. And so like, if you're feeling hungry, you're supposed to not act on it, don't eat, right? So for someone who's trying to get back in touch with their hunger cues, that can make it really difficult to try to heal when in Ramadan, everyone around you is ignoring their hunger cues. And not only that, but for people who are in those binging, restricting cycles. So in Ramadan, a lot of us, when it comes time for iftar, some people are pretty good at pacing themselves. A lot of us aren't, and we might eat a lot more and we might eat quickly because we've been starving all day. So that can really trigger people who are trying to heal from those cycles, right? It puts them exactly in that headspace that they're trying to get away from. It puts their bodies in that same space that they're trying to move away from. And so it can be important to then, if you're not yet at a point where you can work past those triggers, then we may not want you to fast. So yes, it can really mess up your hunger and fullness cues. It can be painful for your body to experience all of that when you're trying to heal from it, and it can set you back in your healing. So what you need to know, especially if you have someone in your life who has an eating disorder, it's not easy to help someone realize that they might need help, especially if they're kind of in the beginning stages of their eating disorder because of diet culture. I think people with binge eating disorder, diet culture can kind of be the opposite of what they're experiencing. But for somebody with orthorexia, anorexia, they may think they're doing the right thing. They may think, well, this is exactly what it feels like everybody's telling me to do. So to get them to realize that they might need help, it's not easy. And commenting on dieting, bodies, exercise can seriously trigger people. So I really like to tell people to avoid doing that. Even if you're talking about yourself, like I need to go on a diet, just refrain from saying that out loud because it can trigger them. And I give this tip to people: encourage them to see a doctor first if you think that they won't be open to seeing a dietitian or a counselor. For whatever reason, people are much more comfortable hearing that they have an eating disorder from a doctor than from a therapist or a dietitian. So it's okay to try to go that route first, if that's just what they're going to be more comfortable with. And then the doctor can kind of refer them to people who can help them heal. How you can offer help. So I've mentioned this already, and I've mentioned it many times because I think it is the most important way that you can offer help, refraining from making comments about body, weight, eating, exercising. And I think that's just general practice to just avoid doing that whenever you're around anybody, because you never know what somebody's going through. So there's a million and one things to talk about. It doesn't always have to be about eating and food and exercise. Definitely refrain from religious conversations about fasting and trying to convince them to fast or ask them why they're not fasting. For parents, keep all foods easily accessible. So yes, that also means things that you might consider junk food, things that you might consider unhealthy or too sweet or too dangerous. Whatever it is, keep it accessible to your kids if you think that they might have an eating disorder. For children, sometimes what can cause an eating disorder in them is if parents are putting restrictions on food. So if your parents are like, you cannot have any sweets at all, those kids sometimes, because that food has been restricted, it really puts that food on a pedestal. And then they might end up hiding those snacks. They might end up hoarding those snacks. It can create a lot of shame around eating that food. And so it can kind of trigger the eating disorder. And so we really tell parents to try to keep all the foods accessible, keep it somewhere where your kid can find it, and don't punish them for eating it. You can, if you're having a hard time with that, then just you can refrain from commenting on it at all. But don't punish your kids for eating what they're eating, especially if they have an eating disorder. And just have empathy for people who are going through this, because as I've mentioned many times, it is not easy, it is very difficult, and it can even be dangerous. So if you or somebody you know has an eating disorder, it's okay to ask for help. It's okay to take a break from fasting. I think sometimes people feel like either I do it all or I do none of it. That's what we call all or nothing thinking, and that can get people in trouble sometimes. So it's okay to just fast some of the days in Ramadan. You don't have to fast all of Ramadan for it to count, right? You can still get reward for just fasting some of the days. And or even, if you're worried about getting triggered, you could even just try it for half the day, see how it's going, and then continue. You don't have to make any decisions right off the bat on how your Ramadan is going to look. Your health is your number one priority. And Ramadan is really all about working on yourself and self-growth and self-improvement. And for you, that might mean healing your eating disorder. So you're doing it if you're even refraining from fasting. And so it's okay to not fast. It might even be really good to not fast for you. It's okay to remove yourself from triggers. So it's okay to not attend iftar gatherings. It's okay to avoid nosy people who ask too many questions. It's okay to take care of yourself first. And this one's really important. It's okay to relapse. I would be surprised if people don't relapse as they're on this healing journey. It's, diet culture is everywhere. You can't avoid it. And so people do relapse very, very often. And it's okay if you thought you healed from it and now you're finding yourself getting back into those habits. It's normal. There's nothing wrong with you. It's part of the process. So if you have an eating disorder, here's what you can expect from treatment. So find a provider that you feel comfortable with. So again, that might be starting with a doctor, and they can help you then find a counselor, a dietitian, finding a team. And then they'll assess you and they'll assess your level of care that you might need. So you might only need to go visit someone in an outpatient private practice or something, which is what I do. And you might be able to just meet with them weekly or twice a week or even every other week, depending on how much care you need. If your health is kind of in a more serious place, then they might want to recommend you to an intensive inpatient unit. So with COVID, they're kind of doing that a bit differently right now, but that could look like going into a facility and staying there for weeks or months until you're in a better place, until you've reached your goal weight. Or with COVID, some facilities are kind of doing it at home, but they check in with you very, very frequently. So you might even want to take time out of like work or school. So it can be a very intense process. So just to set aside time for yourself to be able to experience this recovery. And the purpose, again, is to help you heal your relationship with food and heal your relationship with your body and your body image. So If you're considering whether or not to fast this Ramadan, talk to one of these providers. They'll be able to help you figure it out. They might want to see if you're at your goal weight yet, if you're eating yet. They might want to see how your coping skills are. So you will experience triggers during Ramadan, right? People are starving all around you. People might even be engaging in like a kind of a pseudo binge eating, purging cycle in front of you just by the nature of Ramadan. And so that might trigger you. So we want to make sure you have your coping skills in place before you head into it. And then just be ready to heal from past events, past traumas, even relationships that are impacting you today. And I think I'm almost through these slides here. This is one of the last ones. So I like to show people the healing spiral. So most people think that healing is just this uphill journey, and it's not, right? There's going to be relapses. Relapses are normal. They're part of the process. So it's more of a healing spiral. So if you're looking at a spiral from the top, it's going to look kind of like a circle. It's going to look like you're just going through the same behaviors over and over again and you're not moving. But a more realistic look is looking at it on the side and seeing how you are moving. It looks like a circle from the top, but you're in a different place and you will always be in a different place. You'll always keep moving and keep improving. And over time, it could take months, it could take years even sometimes, and that's okay too. Everyone's on their own pace and it's all normal and you'll get to a different place than you are today. And lastly, I just want to point out some resources that are helpful for people. So if you want more information about eating disorders, there's a great ED catalog. It's a website that has a lot of books and other articles and stuff with resources on all kinds of different eating disorder related things. The National Eating Disorder Association has a crisis text line. So if you have an eating disorder, you can text NEDA to 741-741 and there'll be someone there to talk to you. ERC, the Eating Recovery Center, they do assessments for people who think they might have an eating disorder. They're great. They're located. They have locations in Texas and in other parts of the country. And so that's a great resource to go to as well. Okay, and those are all my slides. So we can go to Q&A. I'm going to stop sharing. Okay. All right.
So I guess I can't start my video for some reason. It's blocked me from doing that. Thank you, Najeeha. That was really helpful. I think that's such an important topic to talk about. And especially as a child psychiatrist who deals with a lot of eating disorders in my clinic, this is a pretty common thing. And I like how you kind of mentioned it goes unnoticed. People do not know or have struggles. My thing from a medical perspective is I worry about eating disorders, partly because 18% of eating disorders have a high mortality rate. So like in compared to depression, anxiety in kids, eating disorder is one of those things where we see death rate, partly because of the cardiac issues and stuff. And often it goes unnoticed. So people have kind of not talked about it or getting help. And then the excessively exercising in parents, I think there's a very thin difference, a fine line between saying, hey, this is an eating disorder versus this is my teenager who's just trying to exercise and stay healthy. So a lot of parents do not notice it until it's too late in the thing. And then there's not enough research out there, but they're talking about if you're not on your 85% of your BMI weight, often your brain's not functioning, it's not getting the nutrition it needs, you're making poor decisions, your anxiety is high. And it then leads to the secondary diseases of depression, anxiety, and it can be vice versa. You could either have depression, anxiety, which can further take you down to the eating disorder. The most common thing that I tell people with eating disorders, it's a control illness. So there's something that's going wrong and the child wants to control things. And more often, child or an adult, it's usually the one thing they can control is their food. So they get focused on food. And so really addressing issues related to what is it that's not is sounding chaotic around in the family? What is going so chaotic that they can't control that, but they want to control the eating? So a lot of this is family approach, sitting down and having a meal. And we just did a talk the other day, and we're talking about how often we're losing this whole concept of sitting down and having one meal a day as a family. Because part of the treatment for eating disorder is a lot of family approach and eating meals together. and making it more enjoyable, engaging, and doing that. So, unfortunately, we need to still, all of us sort of have to work at having dinners together, being non-judgmental, engaging in those. And in Ramadan, certainly, I think there's a big struggle with people who have an eating disorder where the meal is not there or is there, but people are making judgments on how they eat and take. I just want to hear your take on what do you kind of tell people, like family, if it's a mom who's struggling with, I notice an eating disorder in my child, but I can't, how do I talk to her or how do I engage? What would you be saying to them?
Yeah, that's a great question. With young people, minors who have an eating disorders, the family is a huge, huge part of the process. So I think it almost has to be like a whole family conversation where you encourage everyone in the family to not be making comments about dieting, exercise, about food, and again, making all foods accessible, especially you yourself as a parent, to make sure that you're in a place yourself where you're not commenting negatively about your own body. If your child is kind of in denial, yeah, it can be really difficult to convince them to go get help. If they are a minor, then you can technically force them to go into therapy, although that's not fun for a kid to be forced into going to therapy. A lot of times what you can do, eating disorders are never just about the eating disorder. As a matter of fact, I would say eating disorders are really more of the symptom, and there is something going on underneath. And so you won't see somebody with just an eating disorder and nothing else going on in their life. That's not usually common. So what you can do is you can kind of point out some of the other struggles they're having, like, oh, you've been really stressed out at school. Maybe it could be helpful to talk to a therapist, and just normalize that it's okay to get help. Lots of people do it. Lots of people go to counseling. It can be really cool. It can be really fun. And to kind of really be there with them and support them. A lot of my teen clients also can feel the opposite end of that, where their parent is almost too involved, and they're like really over monitoring what they're eating. While I do think parents are a great tool to use in helping people recover from their eating disorder. Sometimes kids can feel like it can be a bit hard to breathe if their parents always monitoring them and making them feel like they're not eating enough, and so they're never going to recover, and giving them threats that, like, oh, if you don't recover fast enough, then like this is going to be taken away, or if you don't gain weight, then you're not going to get to do this summer. And I think that stuff can be a bit difficult. So for parents to just approach it in a gentle way, in a positive way, not to scare your kid. They might already be feeling scared about their future and what it could look like, but to just really be there with them, support them, let them know that everything they're experiencing is okay, it's normal, nothing's wrong with them, and that we can get them help, and there's nothing wrong with getting help.
No,
So
certainly. That is a really good point about normalizing things and not kind of getting judgmental. That's a big struggle with any of our illnesses, mental health illnesses, right?
yeah.
So normalizing things in a way. And what about kids? So if they have an eating disorder and the parents push it down the carpet by saying, oh, you're just making it up. We get that a lot from our community, right?
Yeah.
Either be depression, anxiety, or an eating disorder. And your child says, oh, I'm struggling. And your parents like, you're learning all of this and it's not that. How would you suggest that kid get help? Or
Yeah, that's a really difficult situation to be in, because I mean, well, a lot of kids might need their parents' help. They might need their insurance, help them pay their fees for counseling and therapy, and seeing a dietitian. And so that can be difficult. If you can still reach out to the Eating Recovery Center, the ERC, and they can still do an assessment, and they can even try to talk to your parents and help you out. If you set up like a free consultation with a therapist or a dietitian, they can also talk to your parents for you if you want, and kind of like reiterate to them that actually this is really serious and we need to be seeing your kid. So if you feel like you can't do it alone, you can get professionals involved. You can get people who are in the field who talk to parents regularly involved, and you don't have to do it by yourself. So if you're comfortable with that, I would really encourage you to see if you can get on the phone with a therapist who you think you might want to see, or the Eating Recovery Center who will do your assessment, and see if they can help you with this.
Yeah, most definitely. All illnesses, eating disorder is also a spectrum. You can start with somebody who's
Yeah.
just not eating a little bit, counting calories, restricting, exercising excessively, to the other end of really starving themselves, not have energy, needing inpatient for them, because now it's at the point that they want to eat but may not be able to eat because their brains kind of got into this mode. So I think people forget to understand that eating disorder kids sometimes do want to get better, but their own cognitive thoughts are so blocking in a way that they
Yeah.
can't think beyond things. And yeah, ERC, I really like Eating Recovery Center. They do a great job. And part of the treatment module in eating disorders is you start with medication, antidepressants, anxiety medications, sometimes to help you kind of think better, make better choices and things like that. But also it involves a whole treatment program where you have a dietitian, a therapist, and ERC has two options, eating recovery. One is the IOP, which is 3 hours, 5 days a week, I think, after school, where they kind of do the therapy, the group monitoring, give you meal plans and monitor all of those. And then there's a other level, which is partial hospitalization program, which goes like 8 to 3 for 2 to 4 weeks. All of this covered with insurance, where people can do half day of school at self-paced and half day of therapy. And then definitely inpatient is some for somebody we're concerned, because when they come to me, I do labs, and if we have abnormal labs and we're concerned that they losing the potassium, sodium, not keeping up with their things like calcium, then we really worry. The biggest thing I talk about in eating disorder kids is the struggle with when they start losing calcium. Osteoporosis is something we see later on in early 40s. People don't understand. We are able to replace sodium and potassium, but we're not able to replace the calcium that your body loses from your bones. It cannot go back at the same pace. So having bone density loss and bone problems later in life for an eating disorder is a big common problem. um,
Yeah.
I think they
Yeah.
need to understand the intensity of that. It's not just an illness that you kind of just have problems now, but you continue
Yeah.
to have it.
Right. It can be the effects can be very long lasting in a way that a lot of people don't realize. And I think, there is some cool research that shows that I think like it's something like the scare tactic doesn't always work with teenagers. So if you tell them like, oh, you're going to experience these things, that may not like really deter them from doing it at all. Um, and I think that's important to note for parents, that like that should be on your radar, that okay, this is the long-term effects if my kids are not eating, that this is a real illness. For kids, it might be beneficial to take kind of like a more positive reinforcement approach, like okay, like look at all these cool things you'll be able to do if you don't have this eating disorder. And that's part of therapy too, is helping them decide that they don't want to have this eating disorder, because we do have a lot of clients come in that they're kind of like, they want help but they're on the fence, like Dr. Afshan said, they're kind of like, they can feel so trapped inside their own cognitive cycles of like, I know I don't want to live this way, but also I'm getting something from it, and they just kind of keep going in these cycles. And I can have one session where somebody's saying like, yeah, I'm so excited to be done with this eating disorder, and then the very next session they're saying the complete opposite things, and they don't want to be done with the eating disorder. And sometimes that is the work too, is helping them be at a place where they're okay with healing.
And I think that's a great, I always encourage people to kind of learn about intuitive eating. And for people who do
Yeah.
not have an eating disorder too, right? Uh, on a spectrum, we all sort of have these social media influencing how you look, how you appear, what your weight should be, and how our thought process is all around appearance and stuff. So intuitive eating is something. Do you want to tell me how you kind of teach your patients intuitive eating and what kind of resources you give out?
Yes. Okay. There's a lot of cool resources on intuitive eating. There's a book called Intuitive Eating. I think the author is Linda Bacon. And there's also a book, I actually have it right here. So this book, it's called Body Respect, also by Linda Bacon and Lucy Ephramore. And these are great books. Sometimes I have clients start with these readings. And I just sort of like introduce the concept of intuitive eating to them. What intuitive eating is tuning back into your own body's hunger and fullness cues, instead of going to like a government website that tells you like, or just any social media website that tells you like, okay, you need to be eating this many calories, you need to be eating at these times in the day, you need to be like keto diet, this diet, that diet. Instead of following all that, just listen to your own body. These are our natural inborn, it's something that was put inside of us, right? Like we were born knowing how to feed ourselves. And I think there's somebody researched this in toddlers, and what they basically did was they sat toddlers down and they put a bunch of different food groups in front of them. They put everything in front of them. And toddlers naturally just filled their plate with all of the food groups that were recommended anyways. And they took the amount that they wanted, and they only ate as much as they needed. And they, you'd think that they would fill up on things like sugars and candy and things like that, but they didn't actually. And so that's what the goal with intuitive eating is how to basically empower yourself and your body, and getting back into listening to yourself, so you don't have to do calorie counting, and you don't have to wait for a certain time to eat, that you can just do it when you feel it. And so that's a huge part of the healing process with our clients, is just helping them learn to give that respect back to their bodies. Again, starting with giving them actual readings is good, because it'll give like research evidence on why this works for people and how it's a good lifestyle to have. So we always start with telling people about the research and what it shows. And, only something like only 98% of all diets fail. So there is literally no diet, nothing that like these weight loss programs can tell you that will actually sustain you in the long run. People almost always end up gaining that weight back. And so it's because you can't really fight against your body, right? Like you can't hijack that system that already exists. So we just help people realize that system is there for a reason, and that we have to help them get back in touch with it. We basically just have to open up that channel of communication again.
Definitely. And I really love how it ties into our religion. 1400 years ago, we're told it's all of this intuitive eating is 1/3, our prophet already said 1/3 of food, 1/3 water, 1/3 leaving it empty. So to just responding to how your body feels and kind of accepting. I love how you bring up that not hijacking the system you already have. We all have different body structures, body ways, and how do you kind of accept that and work with it, rather than trying to be somebody or follow a diet and expect that those changes will come. A lot of self-acceptance is a big part of eating for all of us.
Yes, right. Self-acceptance is huge, I think. And yeah, I like to tell my Muslim clients a lot, like Allah gave you these, natural cues for a reason. If we were meant to use these like websites that help us do all the calculating for us, then like we wouldn't have these cues inside of us. So it's important to use it. We were given these bodies as a blessing, as a gift from God, and it's important to really pay attention to it and to take care of it.
Yeah, no, Jazakallah. Thank you very much for all of this time and for us to be able to kind of talk about this. And I'm glad it's been recorded. I know it's Ramadan, and for us all, it's busy times. But hopefully this will be helpful for people. And we'll have you here talk a little more about other things, inshallah, in the next few months.
Inshallah. Yes. Thank you all for having me. I hope it was helpful. And I hope I think my contact information should be somewhere. So feel free to reach out to me if y'all have questions or want more resources or anything like that.
Sounds good. Jazakallah. And I'm going to leave the meeting. And I guess because I made you the host, you can also leave.
I can make you the host again if you want, I think. Let me try.
Oh, that's okay. I think we're done here. So
yeah. Okay. Do I have to stop recording?
Yeah, just leave the meeting, I think, and stop. Yeah, stop recording and then leave the meeting.
Okay, sounds good. Okay. All right. Thank you, everyone. Assalamualaikum. I'll maybe stick around just in case people have questions for a few minutes.
Sure.
Okay. Assalamualaikum.